Ever wondered about sickle cell disease? Do you know what causes it and how it affects the body? Well, let's embark on a journey to understand this complex condition. Sickle cell disease, often abbreviated as SCD, is a genetic disorder that alters the shape and functionality of our red blood cells. Instead of their typical round and flexible form, red blood cells in a person with SCD take on a crescent or sickle shape. This seemingly minor change can lead to severe health complications, affecting the individual's quality of life. SCD is not just a disease, it's a lifelong condition that millions around the globe grapple with every day. Understanding SCD is crucial, not only for those living with it, but also for those who might be carriers of the trait. Now that we have a basic understanding of what sickle cell disease is, let's delve deeper into the genetic basis of this disease. The root cause of sickle cell disease lies in our genes. Sickle cell disease is an autosomal recessive genetic disorder. In simpler terms, this means that an individual must inherit a mutated gene from both parents to develop the disease. Imagine each parent passing down a piece of a puzzle that, when combined, creates an image of sickle cell disease. On the other hand, those who inherit just one normal hemoglobin gene and one mutated Hemoglobin S gene become carriers of the sickle cell trait. They're like puzzle makers with one piece missing. They carry the potential to pass on the disease, but usually do not experience its symptoms themselves. This genetic game of chance underpins the development of sickle cell disease, an often misunderstood and underestimated condition. Genetics play a crucial role in sickle cell disease. Now, how does this genetic mutation affect the red blood cells? Let's find out. The culprit behind sickle cell disease is a protein called hemoglobin S. Now let's delve a little deeper. Hemoglobin, a key player in our bodies, is responsible for transporting oxygen from our lungs to the rest of our body. It's a bit like a delivery service, but for oxygen. But what happens when this delivery service goes awry? Well, that's where hemoglobin S comes into play. In individuals with sickle cell disease, hemoglobin S turns the usually flexible red blood cells rigid, warping them into a sickle shape. This transformation is far from harmless. These sickle-shaped cells, unlike their round counterparts, can become stuck in blood vessels, creating traffic jams in the body's highways. This leads to a reduction in blood flow and oxygen delivery to tissues and organs, which can result in a myriad of complications. Clearly, hemoglobin S is not a friendly protein. But what does this mean for the person who has sickle cell disease? Let's explore the clinical features next. Sickle cell disease can cause a range of symptoms and complications, some of which can be severe. Chronic anemia is a common feature, resulting from the rapid breakdown of the sickle-shaped red blood cells. This may leave individuals feeling fatigued and weak. Sickle cell crises, episodes of intense pain, occur when these abnormal cells block blood vessels. They can strike anywhere in the body, causing pain that can last for hours to even days. There's also an increased susceptibility to infections. The spleen, an organ that fights infection, often doesn't work properly in people with sickle cell disease. And over time, the repeated blockages and decreased oxygen supply can lead to organ damage, affecting vital organs such as the kidneys, lungs, and brain. In fact, stroke is a serious risk, particularly in children with this condition. These complications can be quite challenging. But how do we know if someone has sickle cell disease? The answer lies in diagnosis. Diagnosing sickle cell disease often starts at birth. Newborn screening is a routine procedure that checks for various genetic disorders, including SCD. This screening identifies the presence of abnormal hemoglobin, which is a red flag for potential SCD. However, to confirm the diagnosis and identify the specific type of hemoglobinopathy, further tests are required. These could be a hemoglobin electrophoresis or DNA testing. These tests not only confirm the presence of SCD, but also help determine the severity of the disease. Once SCD is diagnosed, the focus shifts to treatment and management. This often involves a combination of supportive care and disease-modifying treatments. Supportive care generally includes blood transfusions, pain management, and antibiotics to prevent infections, all crucial in managing the symptoms and complications of SCD. In terms of disease-modifying treatments, a medication called hydroxyurea is often prescribed. This medication increases the production of fetal hemoglobin, which can reduce the frequency and severity of sickle cell crises. But the only potentially curative treatment for SCD is a bone marrow transplant, also known as hematopoietic stem cell transplantation. This procedure involves replacing the patient's diseased bone marrow with healthy donor marrow. However, it's a complex and risky procedure, not suitable for everyone. While treatments can help manage the disease, lifestyle changes and prevention measures also play a significant role. Let's talk about that next. Living with sickle cell disease requires certain lifestyle adjustments. There's no denying that managing sickle cell disease can be challenging, but with careful lifestyle changes and a proactive attitude, the impact of the disease can be significantly reduced. One of the cornerstones of managing SCD is adequate hydration. Due to the nature of the disease, maintaining a healthy fluid intake can help to prevent the sickle-shaped cells from blocking blood vessels. Nutrition also plays a crucial role. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can provide the necessary nutrients to support overall health and well-being. It's also important to avoid alcohol and smoking, as these can exacerbate the symptoms of SCD. Regular medical checkups are vital. These routine visits allow healthcare providers to monitor the condition, adjust treatment plans as necessary, and provide early intervention for potential complications. But managing SCD isn't just about the physical aspects. It's also important to consider the emotional and psychological impact of the disease. Support groups and counseling can provide a safe space to express feelings, share experiences, and learn coping strategies. And let's not forget the importance of genetic counseling for families at risk. It's a crucial service that helps individuals understand the risks and explore options for family planning. It provides invaluable information to help make informed decisions about having children. Remember, early diagnosis and comprehensive care can significantly improve outcomes for those affected by sickle cell disease.